All right, in this recording, we're going to look at our rotator cuff muscles. So you've likely heard of the rotator cuff muscles. This rotator cuff muscle group is what it really is. So it is a group, meaning it is a grouping of muscles that as they contract and as they are working, they serve a couple of functions. One, they serve to stabilize the shoulder, and they also serve to move the shoulder joint. So we're looking at our humerus as it articulates with the glenoid cavity of our scapula. As these muscles contract, they are going to move our humerus. Now, if you know the anatomy of the scapula and you know these different regions of the scapula, then the names of most of these muscles, the 3 out of the 4 rotator cuff muscles, are going to be very easy. So I'm going to rotate this around, and we're going to look here at our rotator cuff. So we're going to look on the right here. So if you recall the scapula, this region, if I hide this muscle here, this region that you see here, this is the, let me go back. This is the supraspinous fossa, this area of the spine just above it. So this muscle here, I keep dissecting it away. This muscle here is called the supraspinatus, all right? So the supraspinatus sits in the supraspinous fossa. The muscle just inferior to the spine is known as the infraspinatus because it sits in the infraspinous fossa. This muscle on the other side, down here, this is the subscapularis because it sits in the subscapular fossa. And then we have this last muscle here, which is known as the teres minor, okay? So the supraspinatus here, the infraspinatus, and the teres minor all attached to the greater tubercle of the humerus, okay? So that is this lateral aspect of the humerus that you see in this view here. Our subscapularis attaches to the lesser tubercle of the humerus, all right? So what that means is that depending on where these muscles attach, they're going to perform a specific movement, all right? So our supraspinatus here, when it contracts, it is going to be the prime, or not the prime, but it is going to be one of the abductors of our arm. So it's going to cause the arm to move out away from the midline of the body. The infraspinatus and the teres minor are going to result in arm rotation in the external or lateral direction, all right? And then the subscapularis here, this is going to result in internal or medial rotation of the humerus, so of the shoulder here. So if we look at some of these actions here, if we click on this, if we click here, we can see shoulder abduction, so the movement of the arm away from the midline of the body, right? So there it was abducting, there it is being adducted, here it is abducting again. It is moving away, and you can see this muscle right on top, there's our supraspinatus that contracts. Now we also have the deltoid out here, that is the main or the prime mover, the prime muscle that results in abduction of the arm, but the supraspinatus helps in that. So it kind of starts off the process, and then the deltoid would take over. If we look here, we can see medial rotation or internal rotation, rotating inward. So here's our pec major. Let's hide this, and we should be able to see our subscapularis right here highlighted in blue. So as it contracts, it is going to internally rotate our shoulder. We should also see, we can find a different view where we see external rotation. Okay, so external rotation, this is flexion. If we go back here, let's hide these here. External rotation is going to be when the arm is moving outward. So we saw internal rotation, right? External rotation is going to be exactly the opposite. So if we click here, this is going to be lateral or external rotation. So here you see the arm moving outward, right? So there you see the arm is moving away or rotating outward from the midline. So this is external, or sometimes known as lateral rotation of the shoulder, all right? So just as a review, our 4 rotator cuff muscles, let's hide these here. These are going to be let's hide these. So if we're looking on the left side here, they're going to be the supraspinatus, they're going to be the infraspinatus, the teres minor here, and then on the anterior surface, they're going to be the subscapularis.